Hello, my name is Jessica, and I am a first-year medical student at the University of Alberta. In this C3 tutorial, I will be going over how to take a medical history. So you might be wondering when you visit the doctor's office, how a doctor knows exactly how to treat whatever condition you had that brought you in. And the first step to doing that is by taking a medical history. So what is a medical history? A medical history is a tool that doctors can use to gain more information about the underlying medical condition behind a patient's symptoms. Since laboratory tests and scans are expensive and often inconvenient for the patient, doctors take a patient history first to help narrow down a possible diagnosis. Basically, a medical history is when doctors ask a lot of questions to a patient in order to gain more information. But how do doctors know what questions to ask? The answer is that most doctors follow a basic history-taking framework. There are 6 main sections to a history-taking framework. 1, basic information and chief complaint. 2, history of presenting illness. 3, family history. 4, past medical history and current medications. 5, social history. And 6, review of systems. This probably sounds very abstract right now, so we are going to break down each of those 6 sections and give some examples of types of questions you can ask in each section. The first section of the history is basic information and chief complaint. So in this section, your main goal is to get to know the patient and figure out why the patient is coming into the doctor's office. So some questions you want to be asking the patient in this section are their name, their age, as well as their biological sex, so what they were born as, and their current gender identity. The most important question you want to be asking during this section is, what brings you in today? Which the answer is their chief complaint. So once you've figured out what the chief complaint is, you want to move into the section called the history of presenting illness. And the goal of this section is to break down that chief complaint by asking a bunch of follow-up questions to gather more information. So some follow-up questions that you can ask include, when did this start? What makes it better or worse? If a patient comes in complaining about pain, you can ask them to describe the pain. You can ask a patient if they're experiencing any other symptoms, and you also want to ask a patient what they think is going on. Because when you ask them this question, you can figure out how much prior knowledge a patient has, as well as what a patient is worried about, so that you as the doctor can address those worries. It is very important to ask these questions about all symptoms that a patient reports they are experiencing, because not all symptoms start at the same time and not all symptoms have the same severity. The next section of a history is the family history. So some questions you want to ask in this section of the history are, have your parents been diagnosed with medical conditions? And if so, describe them. And the reason why this section is included in the medical history is because a lot of medical conditions are genetic. So whether or not your parents had the condition can influence whether or not you will have the condition. The next section of a medical history is medications and past medical history. Some questions you will want to ask in this section are you currently taking any medications? Have you had any surgeries in the past? And do you have any other medical conditions? The reason why we ask these questions is because we are concerned about patient safety. So before a doctor prescribes any treatment to a condition to a patient, they want to make sure that whatever medications a patient is currently on are not going to interact with these new medications and cause bad side effects. The next section of the medical history is the social history. So in this section of the history, we take a step back from the medical realm and actually try and place the patient into where they would normally fit in society. And there's several subsections to the social history. The first section is home and work life. And questions you can ask in this section include, do you live alone or do you have any kids? You can ask questions about the patient's kids if they have kids. You can ask where a patient lives and what they do for work and if they enjoy it. The reason why you include this section of the history is not only to build rapport with your patients, which this section is great at doing, by the way, but also it helps determine how much access a patient has to medical care and what their socioeconomic situation is. The next section of the social history is diet, and some questions you can ask include what kinds of things do you eat every day, and how is your appetite? And if your appetite is poor, why do you think that is? The reason why we include this section is because a lot of the time, improving diet can help improve a patient's symptoms in a lot of different medical conditions. In addition, we want to ask about appetite because a patient's appetite can influence what kind of medical condition is bringing them into the doctor's office. The next section we want to ask about in the social history is exercise. And we want to ask questions like, how much do you exercise per week, as well as what kind of exercise do you do? So this allows the doctor to paint a picture of how physically active a patient is and whether or not we as doctors need to alter a patient's physical activity regime. The next section of the social history is stress levels, and you can ask a patient if they're stressed about anything and expand with follow-up questions if they do indicate they are stressed about something. And the reason why we include this section in the medical history is because stress can often make some medical conditions worse. So as doctors, you really want to know whether or not a patient is experiencing any current stress in their life. The last section of the social history that you want to ask about is drug and alcohol use. While we're talking about drug and alcohol use, this is a great time to include a brief section on having difficult conversations, because asking a patient whether they use alcohol or drugs is a sensitive topic, and patients may not be comfortable disclosing that. However, it is important that they do disclose this information so that medical professionals can get a full picture understanding of what is going on with the patient. So it is really important that medical professionals are able to build up enough trust with a patient that they feel comfortable disclosing this information. Here are some ways that you can make a patient feel more comfortable opening up to you. You can use a non-judgmental attitude when you're taking the history. You can read body language. So sense if a patient is feeling uncomfortable and sense whether or not you feel it's appropriate to dive a little deeper into that. And in all cases, change your body language and adjust it so that you are acknowledging that they are feeling uncomfortable. Third, a great way to preface this section of the social history is by saying that things you share during this history is kept strictly confidential between you and me. I am gathering this information so I can develop the best treatment plan for you. By saying this, you not only reassure a patient when they're providing you with this sensitive information, you're also showing that you have the patient's best interests in mind. If the patient is still uncomfortable, acknowledge that you tried your best and make a note of it, because maybe during a future visit or maybe further on during this history, a patient might build up more trust with you and become more comfortable disclosing that information. So it's important to note it down to potentially revisit it in the future. The last section of the history is a review of systems, and the purpose of this section is, as the doctor, to make sure that you haven't missed anything before you start making a treatment plan. So what this essentially is the doctor goes from head to toe and asks a bunch of yes or no questions about a patient just to make sure they haven't missed any symptoms. So some examples of questions you can ask include, are you having any headaches? Do you have a fever? How is your vision? How is your hearing? Do you notice any skin changes? How is your breathing? Do you have a runny nose or nasal congestion? Do you have a cough? Are you experiencing painful swallowing? Do you have a sore throat? Do you have any chest pain? Do you have any pain in your arms or legs? Do you have any abdominal pain? Do you have any discomfort when peeing or pooping? And are you having any night sweats? Something that's important to note is the structure of these questions are quite different from the structure of all of the previous questions you've asked during your medical history. So the questions in all of the previous sections of the medical history are very open-ended questions, and they allow the patient to elaborate as much or as little as they want, and they really allow the patient to guide the conversation, which is important in not only building up trust with your patient, but also allowing the patient to give their perspective of what it is they have and not injecting any medical bias at the early stages of the history. You'll notice that these questions are very closed-ended and most of them can be answered with a yes or no answer. And the reason for that is by the time you've reached the end of the history, you're really just checking to see if you've missed anything. So that concludes this tutorial on how to take a medical history. Please watch part 2 of this tutorial so that you can see an example of how a history is taken.